Namaste, I am Dr. Shoba Venkat, Senior Consultant Obstetrician and Gynecologist at Cloud9 Old Airport Road, Bangalore. Multiple pregnancy is highly fascinating, however it carries high risk both for the baby and the mother. It's a real challenge both for the treating obstetrician and the patient, and of course to our sonologist also. There are some complications which are exclusively because of the multiple pregnancy. So let's consider in the first trimester, that's in the first 3 months of the pregnancy, there could be excess vomiting because of the extra production of the hormones, which can lead on to some nutritional deficiencies and also dehydration. And also there is an increased risk of abortion in the multiple pregnancy because of the increased chromosomal and also the congenital anomalies in the babies. In second trimester, there is an increased risk of pregnancy induced hypertension and excess water around the baby, what we call it as a hydramnios, and there is also an increased risk of the IUGR and the abruption placenta, where there is a premature separation of the placenta, and because of the large size of the placenta can extend into the lower segment. The condition called placenta previa is more common in the multiple pregnancy, and multiple pregnancies are also associated with increased risk for the diabetes. And preterm delivery is one of the dreadful and very common complication associated with the multiple pregnancy. And following the delivery, they are at increased risk for the excess bleeding, what we call it as a post-partum haemorrhage, and they might have challenges with respect to the lactation, and because of difficulties in handling two babies, probably there is also an increased incidence of postpartum blues or the depression in multiple pregnancy. In general, there is also an increased incidence of caesarean deliveries in multiple pregnancies. Under normal circumstances, each baby is surrounded by a membrane called the amnion and one more membrane called the chorion. So in twin pregnancies, what happens, there are two babies. If each baby is surrounded by its own amnion and a chorion, it is called dichorioninc and diamnionotic. The beauty of that is that each baby has its own independent circulation and is its own placenta, because of which the complications are much lesser. Whereas if we consider the other type, where the two embryos, each one have the amnion around it, but both together have a single chorion, what we call it as a monochorionic and diamniotic twin pregnancy. What happens here is that they may have two different placenta, but however there could be a vascular communication between the two placenta, which can lead to special complications in these type of pregnancies. Or they may have a single placenta, which might do little bit of partiality for the blood supply for these two babies, which in turn can lead to some special complications. That is why it is very important to identify whether it is a monochorionic or dichorionic, monoamniotic or diamniotic in the initial stage of pregnancy, so that we can lay down a specialized antenatal care pattern and also a scan modalities for these pregnancies and handle them accordingly.